Welcome! The purpose of this video is to introduce you to Dementia Capable North Carolina. Dementia Capable is North Carolina's commitment to dementia prevention and support. During the course of this video, we will give you an overview of what dementia is, risk factors and prevention, and the impact dementia has on caregivers and communities in North Carolina. We will also tell you about what North Carolina is doing to address dementia. Are you aware that in North Carolina, nearly 12% of adults ages 65 and over are living with Alzheimer's disease? In some counties, the rate is as high as 1 in 6. These rates are projected to grow in the coming years, and so North Carolina has committed to promoting brain health across the lifespan, improving statewide awareness and education about Alzheimer's disease and related dementias, supporting people with dementia and their families, improving and enhancing services that support greater quality of life, reaching underserved populations, and improving data collection and research around treatment and prevention of Alzheimer's disease and related dementias. Altogether, this is known as Dementia Capable North Carolina. Before we talk about dementia, let's talk about brain health. Brain health refers to the brain's overall ability to function properly. Key indicators of brain health include mental sharpness, emotional stability, and the prevention of cognitive decline. Brain health is important for overall well-being and quality of life. Valuable steps that individuals can take to promote brain health include eating a healthy diet, regular exercise, engaging in mentally stimulating activities, avoiding stress, and managing chronic health conditions. On the other hand, factors such as chronic stress, lack of sleep, and poor nutrition can negatively impact brain health. Poorly managed chronic health conditions such as diabetes, heart disease, and obesity can also impact brain health. As we grow older, even a healthy brain undergoes changes that can impact its structure and function. However, dementia is not a normal part of aging. It is caused by diseases and injuries to the brain. A healthy brain can age gracefully. The brain naturally shrinks with age, particularly in areas that process memory and learning. This may contribute to the cognitive decline associated with aging, like processing speed and the ability to multitask. Brain chemistry normally changes with age and can affect cognitive function, memory, mood, and emotional regulation. Changes in cognitive abilities vary among individuals and are influenced by genetics, lifestyle, and medical history. While these changes in brain health are normal and expected with aging, there are many things we can do to maintain brain health and potentially slow down the progression of age-related changes. This includes healthy diet, exercise, mentally stimulating activities, stress reduction, managing health conditions, quality sleep, social engagement, and avoiding harmful substances. Now that we have a better sense of what brain health looks like, let's talk about cognitive decline and dementia. You've probably heard of dementia, but do you know that dementia is not one thing, but rather an umbrella term for conditions caused by different brain disorders? Dementia is a set of symptoms caused by underlying brain malfunctions. Typically, dementia includes memory loss, language difficulty, and impaired judgment. Did you know that Alzheimer's disease is the most common and well-known cause of dementia? In North Carolina, about 1 in 7 people aged 65 or older has dementia caused by Alzheimer's disease. Alzheimer's contributes to approximately 60 to 70% of dementia cases and is the 7th leading cause of death in North Carolina. Other types of dementia include vascular, Lewy body, and frontotemporal dementias. There is also dementia associated with Parkinson's and Huntington's disease, head trauma, HIV, and alcohol. The most common forms of dementia are often referred to as Alzheimer's disease and related dementias, or ADRD. You can see how important brain health is for prevention of dementia. Healthy body equals healthy brain. Let's talk about specific risk factors and ways individuals can protect themselves from developing dementia. While some risk factors, such as age and genetics, cannot be controlled, There are 12 known risk factors that account for around 40% of the risk of developing dementia. This includes hypertension, smoking, obesity, depression, physical inactivity, diabetes, hearing impairment, lower educational attainment, low social contact, excessive alcohol consumption, traumatic brain injury, and air pollution. In other words, 40% of this risk could potentially be avoided or delayed. Taking a lifespan perspective, early age interventions in education, for instance, could impact dementia rates later in life. Now let's look at the rates of dementia in our state. Both the number of older adults and the number of those with dementia are going up in North Carolina. According to the Alzheimer's Association, by the year 2050, it's projected that there will be 320,000 individuals living with Alzheimer's or other forms of dementia in North Carolina. However, not all people are affected by dementia equally. In North Carolina, more than 2 out of 3 of all people living with Alzheimer's disease are female. African Americans have dementia rates that are almost 1/3 higher than that of whites. Lower income is associated with higher rates of dementia. People living in rural areas are more likely to develop dementia than those living in urban areas. These disparities are due to a variety of factors, including differences in access to health care, stress, environmental factors, and hormones, among others. What does this mean for those impacted by dementia, or their families? What does it mean for our state overall? For individuals experiencing dementia, early signs and symptoms can include forgetting things or recent events, losing or misplacing things, getting lost when walking or driving, being confused even in familiar places, losing track of time, difficulty solving problems or making decisions, problems following conversations or trouble finding words, difficulties performing familiar tasks, and misjudging distances to objects visually. Common changes in mood and behavior include feeling anxious, sad, or angry about memory loss, personality changes, inappropriate behavior, withdrawal from work or social activities, and being less interested in other people's emotions. Dementia affects everyone differently. However, as the disease progresses, the need for help with personal care increases. People with dementia may not be able to recognize family members or friends, develop difficulties moving around, lose control over their bladder and bowels, have trouble eating and drinking, and experience behavior changes that seem like aggression. These can be distressing to the person with dementia, as well as those around them. When memory loss interferes with activities of daily living, family members, often spouses and adult children, step in and become caregivers. It's important to understand the tremendous burden on caregivers of those with dementia. Caregivers typically experience emotional stress and burnout, physical, financial, and relationship strain, social isolation, time constraints, and guilt. The Alzheimer's Association estimates that 356,000 North Carolinians provided $7.3 billion in unpaid care for people with dementia in 2021, and the estimated economic impact of lost productivity due to dementia caregiving was $1.4 billion. These costs are expected to increase as the population ages and the prevalence of dementia continues to rise. So what is North Carolina doing about Alzheimer's disease and related dementias? The answer involves decades of work across the state that has culminated in the initiative known as Dementia Capable North Carolina. The term dementia capable reflects deliberate attention to the impact of dementia on all aspects of the community. Let's look at the history of programs and initiatives in the state. In 1980, Lisa Gwyther established the Duke Family Support Program. In 2001, Project CARE was introduced across the state as a coordinated delivery system for dementia caregivers. In 2005, Project CARE was recognized as a national best practice model by the U.S. Administration on Aging and Research Triangle Institute. In 2014, we might say that the current era of dementia work in North Carolina was launched with Senate Bill 744. Through a mandate from the General Assembly, a task force was charged with developing an actionable strategic plan for the state of North Carolina to address Alzheimer's disease and related dementias. Many organizations were involved in the 2015 statewide multi-stakeholder task force on Alzheimer's disease and related dementias. The task force, now the Coalition for a Dementia-Capable North Carolina, meets quarterly to oversee progress and implementation of the strategic plan. The following priorities drive the work of the coalition. 1. Promote brain health across the lifespan. 2. Raise awareness about Alzheimer's disease and related dementias. 3. Provide supportive options that foster quality of life. 4. Support caregivers and families touched by ADRD. 5. Promote meaningful participation in community life. And 6. Reach those who are underserved. There are many other initiatives and organizations aligned with these priorities. BOLD NC stands for Building Our Largest Dementia Infrastructure for North Carolinians. BOLD's activities, now integrated into the work of the coalition, focused on risk reduction, early diagnosis, the prevention and management of comorbidities, avoidable hospitalizations using evidence-based strategy, data prioritization, and a social determinants of health approach to reach populations most impacted by cognitive decline, as well as their caregivers. The North Carolina Registry for Brain Health maintains a list of North Carolinians who wish to receive information on how to optimize their brain health. Registry members receive information about opportunities to participate in research studies and learn more about dementia and brain health. The registry also aims to reach underserved and underrepresented communities in need of services and often overlooked in Alzheimer's disease treatment studies. Dementia Friends North Carolina aims to change how people think, act, and talk about dementia. By understanding what dementia is and how it affects people, we can each make a difference for people affected by dementia. Dementia Friends champions provide free information sessions across the state through the area agencies on aging. The Dementia Friendly Communities and Hospitals Network is made up of towns, cities, counties, hospitals, and other organizations across North Carolina working to empower people with dementia and their care partners to live with greater inclusion and well-being in their communities. Each quarter, the Dementia Friendly Network meets to share best practices, generate new ideas, and collaborate with similar programs across the state and country. Many other organizations also provide supportive programs, services, and other resources for caregivers. On May 2, 2023, Governor Roy Cooper issued Executive Order No. 280 announcing North Carolina's commitment to becoming an age-friendly and dementia-friendly state. This will include the implementation of a multi-sector plan for aging beginning in May 2024, which will focus on strengthening communities for a lifetime, supporting older adults and their families, optimizing health and well-being, and affording aging. You too can become part of Dementia-Capable North Carolina. Find out what's going on and get involved through our website at www.ncdhs.gov/DementiaCapableNC. This video was created by CARES at the UNC School of Social Work for the North Carolina Division of Aging.